Good afternoon, everyone. Thanks for joining us for another learning community. As a reminder, this is a virtual community designed to support maternal health providers and service organizations in providing care with a client-centered, culturally safe, and respectful framework. And today we are really excited to have with us Tiffany Law. And Tiffany is going to be talking with us today about community health initiatives, more specifically, the Inland Empire Community Health Initiative. And I'll just share a little bit of background. If you haven't already checked out the quick videos on our site, Tiffany Law is a dedicated mother of four-year-old twins and a passionate advocate for community health. She serves as program manager at the Inland Empire Community Health Initiative, IHI, where she works to improve health outcomes in underserved communities. Tiffany earned her bachelor's degree in psychology from the University of Redlands and is currently pursuing a master's in public policy and administration at the same institution. Her work is driven by a commitment to creating equitable health policies and fostering sustainable community programs. Tiffany hopes to continue her work at the local level to better foster sustainable understandings of best practices in promoting health equity and health justice. And with that, we welcome Tiffany Law to our live Q&A this afternoon.
Hello, thank you so much for having me. I'm so excited to be here today.
Yay, we're so excited to have you. Um, so we've already heard a little bit about you on the 5-minute clips or the clips that we have on our site, but I wanted to know and wanted for you to share with folks here. Tell us more about the Inland Empire Community Health Initiative or IHI, what it is, what the mission is, and like as program manager, how you support this mission.
Yeah, so we started out back in 2015, I believe, as a collaborative of different agencies throughout San Bernardino County, working to fight the level or the lack of healthcare enrollment when it came to children specifically. And so since then, we have kind of branched out, moved into Riverside County as well, and kind of expanded our mission to not include only children, but children, families, and seniors, and a focus on culturally sensitive, equitable, and supportive based healthcare. So we do this through our advocacy, through our education, and through our enrollment services. So we work as kind of a convener within the IE. So we subcontract our enrollment pieces out to specific agencies that we have close relationships with. One of those are in Riverside County with Neighborhood Healthcare, and our San Bernardino subcontractor is Unidos por la Música. They do a lot of the outreach, enrollment, and utilization, as well as the renewal aspects of our enrollment-based grants that we have. And then we also do a huge piece of education. So we have two separate kinds of forums. One is our health-based forum. We just had a May mental health one, where we focused in on mental health needs in rural communities specifically. So we had some great speakers that kind of talked to the necessities and needs that differ within rural communities and kind of fighting that stigma in a rural community. And then we also have a legislative forum that was actually crafted by, at the time, Assemblymember Perez, who is now a Board of Supervisor in Riverside County for District 4. He thought it'd be really important for us to kind of bring in legislators into the Inland Empire so they got a really good grasp and understanding of the individual and unique needs of the Inland Empire. So we have our legislative forum who we bring in someone from Board of Supervisors, someone from the state assembly and the state senate, and sometimes a federal person as well. And they discuss complex needs within the IE. This past March, we had ours around the federal rollouts and changes that are happening and those impacts that took place and how they're going to impact specifically Inland Empire. So we had Board of Supervisor Joe Baca, who spoke. We had State Assembly uh, Cervantes, I want to say, oh no, Ochoa Bogue, and Assembly Member Jeff Gonzalez. So they kind of spoke about how they are planning on working within the state legislature to support Medi-Cal or to reform Medi-Cal, and kind of how state funding and state changes are going to be impacting that. We also are going to be doing another forum around health specifically near the end of the year. And so that's kind of our education based space. And so, tied with our legislative forum, we also have our advocacy that we do at the state level. So, we actually go up to the state level and meet or drop off information with all 21 IE legislators. I think this past April, we met with about 10 of our legislators that are covering the IE, and got to speak with them about how Medi-Cal is impacting their constituents, the support that we need to better support their constituents and our inner communities, and some of the bills that are up right now that we are looking to support that better expand healthcare to not only being for those who are documented, but also those who are undocumented through not only Medi-Cal, but covered California as well.
Wow, it sounds like there's a lot of work happening on your end, and that sounds fantastic. Um, so how did you specifically get into this work through IE Chai, if you want to share a little bit of your background?
Yeah. So as program manager, I kind of have little ties into all of those things. I actually previously worked as a program manager for an organization or company called Graduation Alliance, and they did absenteeism-based supports for school districts. So I worked with the Michigan Department of Education, the North Carolina and South Carolina Departments of Education, and contracted with their individual school districts to support getting students into this absenteeism program. And I saw the impacts of direct service work, whether it be through the academic coaches that were in that space, and also through my background in hotline advocacy at the Michigan Coalition to End Domestic and Sexual Violence. And so I saw the impacts of direct service. And I wanted to kind of branch out within my own community. I had moved from Michigan back to California and wanted to kind of see what services, what organizations are doing some of the pivotal work. I am a huge proponent in healthcare being a human right, not just a privilege. And so I wanted to kind of dig deeper into that sphere while also expanding my understanding of how to make um, equitable and sustainable change within a space. So, specifically within my organization, we do a lot of advocacy and policy. Previous work that my agency had done before I came in was partnering with I think it was a state senator at the time, to make college students have mandatory health care. So whether it be contracted through the school, whether it be through Medi-Cal, because there was a huge lack of that, and how that kind of changed the atmosphere around school campuses where they were able to get health care and get support. And we know the kind of things that can go around in college and how they can kind of knock you out. So I saw that, and I saw myself wanting to really do more change at a higher level. So joining my organization, I didn't necessarily know what I was getting into. I knew that I was going to be doing a lot of grant-based deliverable work, which was basically the first work year of my job. I was working through a DHCS grant and a Center for Medicaid and Medicare grant for the CMS for the federal government. And so I was really focused on meeting deliverables and writing reports and kind of creating and maintaining relationships with different organizations throughout both of the counties. Um, but I found that some of the most interesting changes can take place when you go a little higher, whether that be meeting with board of supervisors, whether that be meeting with district offices. or in my case, meeting with state legislators and giving them a very clear view of what's going on in the communities, how we are serving their communities, and understanding what it means for us to speak directly to them about the changes that are taking place.
Great. So it sounds like you had your interest in direct service and how it impacts your specific populations, but
Mhm.
you're able to work kind of, I won't even say on the back end, but you're able to work on the legislative and advocacy end to let people know what's happening in the communities, what kind of services are being offered, and where change might need to be made. Would you say that's fair?
Yeah, absolutely. I think I am really a behind the scenes kind of person, because a lot of our subcontractors are doing some of that direct enrollment support, and are really ingrained within their communities. And so that's kind of what we found was the most sustainable for our organization. Um, Organization technically is myself and our interim executive director, and then our board of directors and our advisory council. So we're a pretty unique organization where it's really just the two of us. And we found that partnering with agencies who have close knit ties in their community make a huge difference, especially with all of these federal rollouts around immigration services and the fear that is within communities. We still wanted to let them know what they have available to them, and a trusted messenger was going to be the best way to do that. Plus, we really love the idea of kind of sewing back within our community. We know that the Inland Empire is sometimes starved of funding, so we found it to be really beneficial to sew back into the community by providing these grants or these subcontracts to organizations who are doing meaningful and equitable work within their individual communities.
Awesome. Thanks so much for that. I do have another follow-up question. I know I've given you a list of questions, but I'm deviating here a bit.
Yeah,
But
that's okay.
can someone come directly to you, or this might be coming later anyway, but can someone come directly to you for enrollment services? Is that part of what you offer? And what does that look like?
Yeah. So we do receive referrals from agencies that either we have close ties with or we meet kind of at community meetings. We do not necessarily do the enrollment piece, but we do refer out to either of our subcontractors. Um, Genuinely, because for some people, they want a phone-based enrollment support. So we have enrollers that do that. Some want to come in person. Some may come in person and want Medi-Cal or Covered California, but may find that they are eligible for a ton of other support services as well. So because we kind of contract specifically with Medi-Cal, we want to make sure to tie them back into our subcontractors who can refer them to and help them apply for SNAP or for TAMF or for EBT or for really anything, even WIC services, anything that they are eligible for that kind of is outside of our purview. I
Thank you.
hope that answered your question.
Yeah,
That's
you did, you did. And so you also mentioned like and are describing how unique your services are or your program is. And
Mhm.
so and then also in the vignettes that we already recorded, you mentioned that sometimes you'll make referral or have partnership or collaboration with other community health initiatives. How does that work? Or what does collaboration look like with those counties?
Yeah. So we are one of 27 community health initiatives under our parent, I guess, organization, the California Community Health Initiative. And we essentially meet with them twice a year, but we have working relationships with our partners in Orange County, in Kern County, in San Diego County, and in LA County. And so we find, being the Inland Empire, that a lot of people who may work in those counties, who may see their billboards, who may see their informationals at their jobs, actually live within either San Bernardino and Riverside County. So they may get a call out at Chiok or at Champions for Health Coverage in San Diego County, or I think it's through the county of Kern County is their CHI. So we may get calls from them and say, hey, someone is looking to enroll, but their home address is in High Desert, or their home address is in um, Ontario or in Riverside City. Would you be able to support them? And so we kind of have these back and forth um, email conversations that we have. I'm on close basis with their program managers. So we kind of are able to continuously work together. But that also kind of looks like, hey, we have someone who was previously with IHP or previously with Molina, and they are looking to transfer. What does that kind of look like? Who are some people within those organizations they can chat with, and vice versa? When I was working in or when I was living in Victorville, because I recently moved down to San Diego County, we were looking to partner with a hospital who had a ton of people who were transplants. So they had come from Orange County, they come from LA County, and that was kind of one of their largest barriers to receiving healthcare at this hospital. They would come into the emergency room. They had Medi-Cal, but they had LA Care, or they had I think there's like three other kinds in San Diego County. They didn't have IHP, so they weren't really sure what to exactly do. So we talked to them about some of the ways that the county could be working with them, kind of brought the players together to better support those individual patients, because you can't necessarily bill out Medi-Cal without having that inter-county transfer take place.
So you're providing like a bridge between counties essentially.
Yeah, absolutely. Yeah. And especially between Riverside and San Bernardino, we work so closely together, but it's kind of like we have two of everything across a very narrow bridge. So it's even bringing those two counties together and trying to figure out what kind of resources could we be sharing, or better understanding how to support people. Um, does one county have kind of a frame of networks where it comes to like community schools, or when it comes to um like in-person enrollment services that we can be mimicking in different counties, just kind of bringing everyone together, because we know collaboration is going to make a huge difference.
Absolutely. Thank you for answering that. I think I might have touched on some of the other questions, but um, what types of services, or I guess, who are the organizations, if you're able to share, that you work most closely with in providing these services? Not you as a direct service provider, but offering services to the counties and the communities. And then how can other organizations or providers refer people through you, I guess, to those organizations, or what would be the best route of doing that?
Yeah. So currently for the OERUs, which is enrollment, retention, outreach, and utilization. For Riverside County specifically, we are utilizing neighborhood health care, and they are actually starting to expand out into San Bernardino County, which is really exciting. They are an FQHC. I think that's the acronym. So they are providing a ton of different resources and have certified enrollment counselors who are doing enrollments not only into Medi-Cal, but into any county or state-based supportive services. Plus, they have really close connections with WIC as well. And we know with the Maternal Health Network, that is a huge resource. Um, and so that's our primary resource in Riverside County. When it comes to San Bernardino, we are working really closely with Unidos por la Música. They are a smaller agency that is working outside of Ontario, but they have a mobile food pantry. And within that mobile food pantry, they go to Highland, I believe Fontana, um, oh, I'm blanking on the other place. I can see the name in my head, but I can't read it. But a couple of different places throughout San Bernardino County, and they dip into a little bit of LA County as well. So all the way up to Chino Hills as well. And so they do, like, they collect information and enroll people through Medi-Cal that they outreach to. So they're hitting a lot of senior populations and a lot of children and families as well. So getting in touch with any of those organizations, although we love to be providing that referral resource, if you do know that agency, reaching out to them directly works as well. I know there is a lot of hindrance when you know that you're going to have to make one phone call, to make another phone call, to make another phone call, or wait back for an email. And what's most important to us is getting people coverage and letting people know of the coverage that they're available for. So they can definitely reach out to me. That is always an opportunity for them. Reaching out to my interim executive director as well. She will ping you to me. So might as well just reach out to me. But if you do know that organization, you see them, reach out directly to them. They have amazing staff who are doing wonderful things. And so they can help you directly as well.
Thank you for that. And not that you need to do this now, but if you can maybe send us in the chat the name of the organization with the food pantry, that would be great too. I think that would be a really good resource for some of our community members just before we're done here. And so you've also mentioned, again, uplifting community members to be aware of the services that are available to them and the coverage that's available to them. That's one way, but what are other ways that you're all offering client-centered, culturally competent, and responsible care within IHI?
Yeah. Um, So outside of enrollment, you mean specifically? Okay.
Mhm.
So a lot of our key pieces is around back to our education. So our forums are open for all people, whether you are a paraprofessional, whether you are a parent who is looking to better understand their students, truly everyone, because we believe that education is for all. And so when it comes to our mental health forums, when it comes to our regular health forums that are taking place later on in this year, or even our legislative forums, we think that bringing a space where people are able to voice their concerns, ask questions, and help them self advocate is an incredibly important empowerment based strategy for us. So, by providing these avenues and these spaces for either paraprofessionals or for everyday citizens to speak directly with their legislators, to speak directly with directors and executive groups of different mental health organizations, to ask their questions, to be able to self advocate and have an avenue to do so. That's kind of one of our key spaces. Um, and we are kind of looking to even expand some of these programs. They're kind of in the works right now of different advocacy based academies or empowerment based practices that we are teaching to the community because we find that, or in our last legislative forum, one of the key things that one of the senators took away was the importance of hearing from the constituents. Even though some of the policies sometimes are a lot more partisan than some people would, how do I want to phrase this? Even though some of the policies are leaning more towards a liberal or a Republican viewpoint, it is really important for individual communities to advocate to their legislators. And what does getting involved in voting look like? And how are we able to encourage or inform legislators of the impacts that things are having in their individual communities? And the senator stated that that was an incredibly vital piece of her work within Sacramento. So through our efforts of wanting to kind of bring people together and bring people education on what advocacy means and how they can self-advocate, we are wanting to kind of bring that culturally specific care back into the space by having them advocate. Does that make sense?
Yeah.
Because also that advocacy doesn't always stem just to legislators, but we find that some of those key things that we are looking to inform people on does advocacy in schools, right? Or advocacy with your own healthcare providers, or advocacy when you are trying to, um, more specifically for Maternal Health Network, when you are with your OBs, right? Or when you are creating your birth plan, what does it look like for you to self advocate with people who you may not feel as comfortable with? And what does it mean for you to ask for services that you are entitled to? So, Medi-Cal right now covers a lot of doula services. What does it look like for you to advocate to have your doula there, to be part of your healthcare provision team? And what can you bring forth when it comes to the law or comes to legislation or policies that are passed so that you were able to best advocate for yourself?
Thank you for that. I really appreciate it. Um, so you mentioned at the top of this conversation, recently advocating or going to legislation with mental health at the top. But I'm wondering too, as we close here, are there any upcoming events, projects, information that you can share with our community or that you'd like for us to know?
Yeah. So we are looking to have another health forum, I believe, in September. Sure on the exact topic, but I can have a our newsletter sign up sent out to you all, and that will be provided, I believe, beginning of July, with information on all of our upcoming forums that are taking place. Also, we just had the May revise. Um, I think that was a few weeks ago, or we're going through the May revise right now. So reach out to your local legislators, look up the policies that are maybe being cut when it comes to Medi-Cal. They're looking to um, cipher down who is eligible for Medi-Cal when it comes to documentation status, when it comes to children being automatically re-enrolled. Um, that is going to be a great space for some community-based advocacy to take place. So reach out to legislators throughout the San Bernardino County, or if you're in Riverside County as well. Let them know how you feel about some of those things. Let them know how you would want them to vote, and then talk about how Medi-Cal is impacting either your family, your community, the people um, that you are in charge of, whether it be your clients or just people within your community.
Thank you. So we'll await that newsletter invitation from you. I'd like to open it up to our participants today if they have any questions. We'll just give it a few minutes here just to see if anyone has questions about anything. Thank you so much, Tiffany, for sharing with us today. Oh, Ayana.
Hi, yes. Thank you so much for joining us today. I do have a question. What advice would you give to a person or an organization that is looking to kind of dip their toe into advocacy work? Like maybe they haven't done that before, they're new to the area, they're new to the space, but they see a need. Like what would be the first step, like before stepping on toes?
Yeah. So I am a firm believer that you are never stepping on toes when it comes to your advocacy, right? Whether you are doing it for your family, your community, your organization, your voice deserves to be heard, especially to elected officials, because they have their job because you voted them there. So especially if you don't think they're doing a great job, tell them. It is very important to get involved. Throughout all of my work, because I'm getting my master's in public policy and administration, they have stated that the lack of motivation for things to change is due to a lack of worry from legislators, right? For them, their lack of thinking that they're going to lose their seat. So make them a little bit uncomfortable, make your voice heard. When it comes to where to start, it kind of depends on the individual topic or issue that you're looking for. So first, you want to better understand where exactly your funding or your situation is being funded from, whether it be through the county, through the district, through the city, or through the state, and then you kind of want to go from there. So let's say that you are an organization who is funded by county dollars and you have concerns about that. You can go to the Board of Supervisors and make your grievances known at their meetings. You can go directly to the county, but more than likely they are kind of dealing with the decisions made by the Board of Supervisors, and they have open meetings where you can have those things or speak about those things directly. And then let's say that if they're saying that their hands are tied because of it coming from the state, right? So each um Each state legislator, whether they be an assembly person or a senator, has a district-based office that you could reach out to, and they have individual people that are assigned to individual things. So let's say that you have a housing concern, or you're dealing with food insecurity, or you're dealing with health policy. They have someone in their offices that is tied very directly to those policies and those issues within their community. So you can go directly to that district office, ask them for their health policy, ask them for their X, Y, and Z person, and let them know, hey, I have some things I would like the legislator to know, and I have some things I would like to when it comes to how policies are impacting my community, my family, etc. So that is something that you are able to do, and I would encourage you to do, because truly it is a necessity, and they need to hear your voice, or they're going to be working from their own frame of reference, and that necessarily is not going to be um, indicative or inclusive of the community that they are there to serve. Did I answer your question?
Yes, thank you. Thank you, thank you.
So, we have any other questions? Feel free to raise your hand or put it in the chat. We'll just give it a few more here. And if not, we'll be sure to um, follow up with folks and send out the information that you provide to us about the upcoming newsletter and all that's going on in IE Chai. We thank you again for being with us today.